wrong. You have to honor the original person who actually named this area. He named this as Brockman 312. It's for primary somatosensory area. Now I will just quickly browse you through how you interpret the brain. It's very easy. So here, first we ask about which gyrus. The gyrus is post-central gyrus. Functionally, it is a primary somatosensory, means anything about somatic. That means your skin. Skin is your largest organ. So anything about pain, touch, and temperature. PTT. Your pain, touch, and temperature, and also your joint sense. For example, early morning when you're closing your eyes, you know your limb position. That is your joint sense. When you're sitting down, you know exactly you are sitting. That is the joint sense. Yeah? Stereonopsis. And this is all responsible by somatosensory area 312. But then, right near to it is association area about somatosensory as well. What does it mean? This means this is a memory area for sensory. Then you ask me, Doctor, what do you mean by memory? Now you think about ice cube. Do you have a memory related to it? Temperature-wise, right? Cold. But you're not sensing it now. But how do you know? Because you already store this memory in the association area, and usually association area is larger than the primary area. Because primary is what you sense now, but association area is memory. So you have memory everywhere. Memory about movement in area 6. Memory about senses, pain, touch, and temperature in 5 and 7. And exactly when you search through your bag, without touching it, you can precisely grab your handphone. Why? Because you remember exactly the dimension of your handphone. Yeah, this is how your memory is stored at area 5 and 7 for association area. Now I will go to area 43. Area 43 is specifically for your tongue. So this is actually what you have learned the previous semester. Yeah, the tongue have, what are the cranial nerve involved? The tongue. Special sense, no? I'm talking about special, sorry. I'm talking about the senses of the tongue. So there will be your cranial nerve number 5, cranial nerve number 7, 9, and 10. Yeah, and 10. So, and then now over here, you still remember the 10 is at the most posterior area, yeah? And now, how about area 39, 40? Very important. Not just is a sensory association, it's higher. 39 and 40. When I say 39 and 40, what is angular? What is an angularis? I'm going to show you later on. What is supramarginal? These two higher means higher up. Understanding. Your understanding today. This is the area 39 and 40 and 22. 1, 2, and 3. These three are called Wernicke's area. Wernicke's area. Wernicke's area is for understanding. Just now when I explained to you, you say like this is because your Wernicke can understand. Then later on it connects to Broca. Yeah, Broca and Wernicke must work together. If they do not work together, there's no effective learning in the classroom. When teachers say something is Broca and kids say yes, I understand, then kids reflect and the teacher will see whether the kids really understand. So Broca must marry the W. That's why BMW. Can you remember that? Yeah? Broca must marry the W. Well, if not, then this is the ineffective learning in the classroom. So now, let's have a look here. Yeah? Okay. So, primary somatosensory area, this is also another homunculus. These homunculus have larger head, larger face. Why? Because your face have a lot of sensory by trigeminal nerve. Hand also. Because of hand is so skillful, have a larger brain area for the senses. That's why the blind can read using braille system. Because it's so sensitive. You wouldn't develop a braille system using the skin of here to touch. Right? Because it's not sensitive enough. Most sensitive is at the finger. Yeah? So that is why this is the sensory homunculus. Broadman's area 312. These are all the senses you must remember. Yeah, if I ask you to write down some examples are here. And also genitalius. Genitalius also have higher representation. Now, if someone is having a lesion at here, then they will lose the sensation for contralateral side, of course. And this is the area 43, yeah? Gustatory cortex for the taste. Now, we go on to somatosensory association, Broadman's area 57, very easy. It's about all your memory, past experience. Now, I go to 39 and 40. Very important. This slide is very important. 39 is called angular gyrus. Angular, at the angle here, angular. 40 is called supramarginal, above the margin. Yeah? So that's why it's supramarginal. These two, one is for semantic, one is for phonological. One is helping you to able to write something that you hear. One is, this is the most important here. Sometimes in the kids, they will say that they are dyslexia. When they are dyslexia, that means they have an underdeveloped area 39. This will make them cannot understand, cannot comprehend the content in the classroom. So the patient will exhibit deep dyslexia. They cannot extract the meaning of the word. You know why? Because when they are watching the word are actually floating. What you're seeing now are all floating. They cannot catch the word. Yeah? So this is but to combine it with 22, this whole area is called Wernicke. The W must be big cap. Broca, the B must be big cap. In your essay, please write it correctly for me. Yeah? Broca area and Wernicke's area, B must marry the W. Okay, now this is all about sensory here. Now I come to the occipital. Occipital lobe is for the vision. Also have primary and secondary. Primary is very small, area 17. Area 17. Then you have 18 and 19, Broadman's area are for association. Then you ask me, what do you mean? This is about when you see a face of Dr. Paisi. So my memory, not my memory, is my face is in your area 18 and 19, hopefully lah. Okay, hopefully. But maybe it's your girlfriend and boyfriend is larger here. Okay, but what you see now, when you see me as a form, color today, it is all responsible by Broadman's area 17. Broadman's area 17 is sandwiching the calcarine sulcus, and this help you to interpret color, help you to interpret the sizes, help you to interpret the form, and am I transparent? You can see now. I'm not transparent. Okay? So, and then, but everything must be correlate to the memory, yeah? To the memory. Then area 18 and 19 is about memory of what you see before. That's why you can recognize an object. For example, when you see an object is a car, you remember this is a car because you have a memory of what you see. If you have a lesion, this will cause visual agnosia. So you can always see how I arrange my lecture notes. Yeah, I always say Broadman area, which number, what is the function. Then I tell you if there is a lesion, what happened. See that? Yeah, hopefully this is how you read one by one. Frontal area, parietal lobe, occipital lobe. Occipital lobe, Broadman's area 17 is for primary, 1890 is for association. Now, after I cover taste, I cover the vision, what left? Hearing. Hearing is by temporal lobe. Yeah, temporal lobe. Hearing, I'm coming to the last part is temporal lobe, below the lateral sulcus. Temporal lobe, you have Broadman's area 41 and 42. 41 and 42 is actually the primary, yeah? Primary auditory area. And then you have association area. Now let's have a look here. This is a primary auditory area. Primary auditory area is at the transverse gyrus of Herschel. Herschel is area 41. This is helping you to interpret the loudness, quality, pitch, high pitch or low pitch, and direction of the sound. Yeah? And you also have a auditory area. 41, 42 is primary. Broadman's area 22 is association. What do you mean by association? For example, when someone calling you, and you pick up the phone, you just say, "Hi, it's me," and you know exactly who is he or who is she. Why? Because everyone has different voice quality, and you kind of have that kind of memory inside here. Just like when someone is coming home, you know exactly without listening, without really seeing, you know who is coming back. Because everyone come back with certain kind of the sound associated with them. You know, the way that they close the door, loud or gently. Yeah, you kind of know. Yeah, especially your roommate who comes back, you already know who is coming back now, right? Because you have that memory. So if any public asks you, where do we have a memory hub? Your memory is everywhere. Do you agree with me now? Memory for movement, frontal lobe here. Memory for touching, parietal lobe, yeah, association area. Memory for what you see, occipital lobe. Memory of what you hear, temporal lobe, yeah, very good. So your memory is everywhere. So now, 40, 39, 22 all adds up together is your sensory area of Wernicke. And whenever you have Wernicke, again, Wernicke just like Broca is only on the left hand side. Only on dominant side, left hand. Then how about on the right side? It's not because it has a mobile, no. It also has some function related to it. For example, yeah, now the husband is asking the wife, I think tonight I want to catch up with my buddy, but I'll come home very late. Then the wife say, okay. And or either the wife will say, okay, or okay. Which one is permission? Which one is not permission?
Second one.
It depends. Guys, maybe still confusing, you know. Both you saying okay. But girls very good in this, no? I say that I think I kind of tell you it's a no. Through my tone. It depends. Guys actually baby is a bit underdeveloped on this corresponding side. They're always confused. I think they will say okay. But the ladies will say that I think I'm kind of saying no. But I said you say okay. Is actually can you further interpret the hidden meaning? Hidden meaning in the speech, if you can understand that, that means you have a well-developed right side of the corresponding area of Wernicke. That is actually helping you to carry all the hidden message. When someone's saying that something else, so guys, make sure that you train all this emotional perception. My dear student, nobody saying anything. Very good. Why? What happened here? This is your brain is functioning. You are now seeing my words better. Hadi, you see this is a message. Then what you see now doesn't mean anything because it will first go to visual cortex, activate the neuron here. The neuron will then send a signal to Wernicke area 22, 39, and 40 so that it can understand and comprehend. Finally, because I asked you to say something, then this will then project to Broca area to arrange your cord. Then your cord will send to primary motor cortex to say the word Monday blues. This is exactly what happened. Yeah, what you see or what you hear. So now, and Wernicke and Broca area, how do they connect each other? They connect using arch fibers. These arch fibers is called arcuate fasciculus. You must remember these fibers. Put 3 stars there. If I ask you in exam, if you say Broca must marry the W, what is the fibers that connect these 2 areas? Arcuate fasciculus. This is the arching nerve fibers that's connected to. If this arch is lesion, then Broca will detach from Wernicke. Yeah? So you'll find that the patient will have some aphasia in certain point. Yeah? Then they will have a conduction aphasia. Just now, if someone having problem with Wernicke, comprehension aphasia, or Wernicke aphasia, or understanding aphasia, or sensory aphasia. So again, today I named 3 types of aphasia. Kala-Broca area having lesion, expressive aphasia. If Wernicke area having lesion, sensory aphasia. If it is a conduction fibers in between that is having lesion, this is called conduction aphasia. 3 types of aphasia, expressive, sensory, and conduction. Now, I tell you, in my life, I met one medical student back in 2016. The boy came to me, and then year 2. Then he said that, Doctor, first time in my life, 21, 22 years old, first time I hear the term called Wernicke's area and about plasticity. Then I said that, why does it catch your attention so much? Then he said that, can you tell that I am dyslexic? I said, I cannot tell. If there's dyslexic, through words I can know. I can tell. This is about brain awareness. The parents notified and acknowledged this problem when he was age of 2 already. And he was sent to the UKN Speech Therapy Center for 8 to 9 years. Until that he started from special school and he is able to join the mainstream of curriculum until he enrolled into UPF as a medical student. And all this is because when the brain is still having all this pruning, if you do the right thing, it actually, the brain neuroplasticity can rescue the brain. This is how amazing it is. So I would say that this is actually from the kids' book. Now you can know that it's really very well represented in the, I scanned this from the kids' book. Do you know why what cortex is that? Prefrontal cortex, betul tak? This primary motor cortex. This primary somatosensory cortex. Ni primary visual cortex. Ni I listen. Primary auditory cortex. I talk to my friend from here to here. You see, they say I talk with my friend. They are not saying I talk to my friend. If you talk to your friend, doesn't mean that he or she understands. But you say that you talk with your friend, that means there's an ongoing. You talk, he understands, he talk back, you understand. This is a communication. Then you need the B and W. What is the fibers connecting the two? Arcuate fasciculus. Make sure that you can write arcuate fasciculus especially. Fasciculus, sometimes I see that the word fasciculus is fasciculus. Means it's a nerve fibers. All these actually make sense now. So neuroplasticity, remember your brain can always changing. This is what happened in the normal kid. You have the Broca and the Wernicke area active. You know what is this area? This is the first area when I ask you to decode the jumble word. Do you remember that? Visual, there's a visual word formation area. But in the dyslexic kid, do you see the Broca is larger than usual? You find that dyslexic kid talks a lot but doesn't make sense. Why? Because it's a compensatory mechanism. If the Wernicke is not functioning very much, they will actually overdevelop the Broca. They will talk a lot but not making sense. So, but it's not because of the neuron here is having lesion, no? Sometimes the neuron here are just needing higher threshold. That is why they need to go for the speech therapy, and they will be given certain module to repeat the same thing again until the threshold is reached. And this kid can actually join the normal curriculum again. This is how powerful the neuroplasticity is. So now, before we go to the next topic, what is this brain area, function of this brain area, this large area here?
Personality.
This large area here. Very good. Personality, betul tak? This is the prefrontal cortex, 9, 10, 11, and 12. The largest, the prefrontal cortex and you. So now I'm going to do here. Okay, guys, use your brain. If you don't use it, you will lose it. How many billions of neurons you have?
100 billion.
100 billion. You have to make sure that they always function. And how do you keep them? Yeah? Learn new things. How to learn new things? These are what you do. Listen to new music. Human touch. Yeah? Smell something new. Yeah? And so don't blame the girls if they always want to feel that they never have clothes to wear. You know? Because they always love something new. Yeah? Learn new words, yeah? Social life. And these are the 4 happy chemicals for your brain. DOSE. D for dopamine, O for oxytocin, S for serotonin, E for endorphin. Exercise, eating chocolates can increase endorphin. That is why Valentine's Day give chocolates. Yeah? Happy chemicals. How do you increase happy chemicals? Sunlight. Unfortunately, I don't think you have enough sunlight exposure because there are hours and hours of lecture here. Okay, listen to nice music. That's what we did just now. Or affection. Yeah? Show love, affection to each other. Don't overdo it. Okay? And laughter as well. Laughter.
Oh man.
Exercise. Please run around the campus. Join the Diabetes Day 2024. Then Wawakan. And finally, human touch. Human touch is very powerful. Yeah? Sometimes without even talking, just human touch, is so powerful. And yeah. Okay. Happy brain. Yeah? Okay, now. Oh, what a long journey, man. Okay, now I quickly bring you to these developments, then we can continue. Did I teach you FDR 3001?
30, yes.
I'm the one who teach you that. Okay, I tell you this morning you learned about the brain, how it develops, right? No, you haven't learned it. You learned it when the brain is already developed. Now, we love to ask about essay writing. How to write an essay about how the brain is developed. So I'm telling you an essay. Essay important. But we'll start from you when you're still an embryo. When you're still an embryo, you start with only 2 layers. You only have hypoblast and epiblast. So you're bilaminar germ disc. You are from the blastula. Initially, you are blastula. You only have blood cells. Then later on, you become gastrula. When you have a gastrula, it's because of gastrulation. When you have gastrulation, it's because you develop from 2 germ layer to become 3 germ layer. That's one trilaminar. That's where your neural tube will form. That's where your brain will form. So your brain will form pretty much early, 2nd, 3rd week. It already starts to form. So that's why folic acid, your maternal folic acid intake is important. So now we just quickly come to here. From 2 layer, you are from a blastula, you become a gastrula due to gastrulation. And today we are going to focus on here. This is where, we are going to look at here. When you are still a bilaminar germ disc, only 2 germ discs, not enough to develop everything. That's why you start to have, what is this? Primitive streak. You start to have primitive streak to form. Primitive streak is important, yeah? When you have primitive streak to form, that's where you start to divide your body into right and left. Start to determine where is cranial, where is cauda. Without this, you do not know where is the right left. Everything will grow differently. Luckily, you have primitive streak, but because you have primitive streak, the epiblast, which is blue now, the cells will migrate through the primitive streak and insert in between, push down the hypoblast, and then replace it. And then will now become ectoderm, mesoderm, and endoderm. That's where you start to have 3 layers. And now, what we want to focus is like this. You have the new layer is called ectoderm. Ectoderm. Ectoderm growing, then the primitive streak start to regress. Sudah cukup dah, beauty dia sudah habis. Then it start to retire. Walaupun dia besar, then something else will grow. Notochord will start to grow. When you start to have notochord, you and I are chordate, yeah? Fish, mammalian, we are chordate. When you have the notochord growing, what happens here is, let's say this is the notochord. Again, primitive streak is to allow you to have from 2 germ layer to become 3 germ layer. After you have 3 germ layer, then primitive streak start to regress, but notochord start to grow. When notochord start to grow, this is ectoderm, yeah, ectoderm, blue color ectoderm. Notochord is in the center. When notochord is in the center, the ectoderm right above the notochord, again, the ectoderm right above the notochord will become thicker. The rest here is not thickened because it's far away from the notochord. The region that is away from the notochord will continue to become skin. But the area which is right above the notochord, we will change the name to become neuroectoderm because dia jadi semakin tebal, and it is so much thickening until they will lift up and form a neural tube. After they form the neural tube, then they detach from the skin, and then since then they separated from the skin and start to protected by all the mesoderm. That's where your vertebral column comes in, where your skull comes in to protect the ectoderm. So again, ectoderm give you 2 things, skin and the brain, central nervous system. Yeah. Okay. So now let's understand this concept. Very good. So now, this is you when you embedded. Yeah. When you are the blastula, you embedded into the endometrium. Then from here to here, what is the process from 2 germ layer to become 3 germ layer? Very good. Gastrulation happened. This gastrulation happened, then you have trilaminar germ disc. Because of primitive streak. Okay, now we focus on the blue. Yeah, now many things will migrate through the primitive streak and give you now here. You have primitive streak, then they start to replace and become mesoderm. So you have now 1, 2, 3 layers. Ectoderm, mesoderm, and endoderm. But we only focus onto the blue. Onto the blue. So now, whenever you will find that sometimes when you first see the embryology book, you see this is like a shape of the saliva. So actually, this is how you see it. This is you. This is you growing. This above is an amniotic cavity. Below is yolk sac. Still remember which glia cells originate from yolk sac? Yes, so microglia. Microglia is actually originate from yolk sac. But if you want to see the development, we always cut here. Cut the amniotic cavity so that you can see what is going on. Now, so you can see the blue is ectoderm. This is primitive streak. When primitive streak start to regress, notochord start to grow. Alright? And now you will find that this blue area has 2 regions now. Here, very important. When you have the notochord start to grow, this is the blue area, ectoderm. The area near to the notochord will become thickened. When they thicken, we call it neuroplate or thickened neuroectoderm. The rest is ectoderm. This is special. This area is called neuroectoderm or neuroplate. Alright. So your story starts from first there is a notochord, induce the ectoderm to become thickened. When the ectoderm thickened, we change the name to neuroplate. This plate is thicker than usual. Why? Because they want to become future brains. So now this is where I'm going. Yeah? When it's become thickened, then it folds. Yeah? Why it folds? Then you ask me, doctor, why it suddenly will fold? Yeah? Thank goodness, because you are the embryo. Yeah? You have to fold laterally. You have to fold in 2 planes. Yeah? You fold either is a medial, you fold in medial and horizontal plane. So eventually, this is how you fold in. When you fold, the neural plate also fold into a tube. story begins. Okay, so now this is not an essay. This is just to give you a foundation only. Now I'm coming to the essay part. This is the essay part, yeah? How to write a good essay about the brain development. Okay. I just use one slide, yeah? Starting from here, third week onwards. Third week is trilamina. Second week is bilamina. Third week, your notochord start to induce ectoderm to become thickened. When notochord induce the ectoderm become thickened, we change the name to neuroectoderm. This neuroectoderm is thickened. This will then give you a neuroplate. When the neuroplate is getting thicker, it will start to give you neurofold and grooves. What do you mean? This is like this, yeah? So here. This is when you cut away the amniotic cavity. Now you can see this is your notochord, this is the ectoderm. And this is the thickening ectoderm, yeah? Look at here, notochord will make the ectoderm thicker than usual. Then on both sides, these two are called neurofold. Here, neurofold. Neurofold will grow upper. Why? Because it's thickening. Because these two are forming a fold, then in the center is called neurogroove. You better able to label it, yeah? Very important. Again, this is neuroectoderm that is thickened. After thickening, both sides at the edge will become neurofold. In the center will become neurogroove. Because of the embryonic folding, then they will start to, these both sides will then meet with each other and fuse together. When they fuse together, yeah, then this will form a neurotube. Yeah, then they'll form a neurotube. And because this is a tube, yeah, okay, this is a tube. This is a tube. When they fold, you have the anterior neuropore and posterior neuropore. They remain open, yeah? And the anterior pore always close faster. They close at day 24, 25. The posterior pore close at 26, 27. Maybe you ask me, after any consequence if they don't close? If they do not close, if anterior pore doesn't close on 25th day, this is what happened. No brain is formed. Anencephaly. If the posterior pore cannot close, spinal bifida. So this is where, very important, if someone really plans for having pregnancy, you must be aware your exposure to X-ray. Yeah? Do you need to have maternal folic acid intake? All the teratogen you must avoid. Yeah? Especially anti-epileptic or anti-seizure drug you must avoid. You must be very careful. Yeah? Because that's where the brain is start to form. So if neurotube doesn't close anteriorly and posteriorly, this will cause some defect to the baby. Yeah? So now this is the essay here. Okay? This is where it is. Notochord above, the ectoderm become thickened. After it becomes thickened at the edge, what happened? At the edge, it becomes neurofold. Neurofold become elevated. Below neurofold become elevated, then it forms the neurogroove. Finally, the two folds will starting to meet with each other. Finally, at the tip of the neurofold, when they meet with each other, the darker blue, yeah? The darker blue is called the tip of the neurofold. When they fuse together, they will become neurocrest cells. But the light blue will remain closed as a neurotube. So now you will have three things. Once they fold together, this will remain as epidermis of your skin. Then you have the neurocrest cells, then you have neurotube. And what does the job of the neurocrest cells? You must remember, yeah? We always ask you, derivatives of neurocrest cells. This is the most popular question until when you become in the clinical year a neurosurgeon. Neurocrest cells also something related about neuro. What does it become? It becomes all the ganglia of your sensory. it becomes many things that we're going to see that. It will become the melanocyte of your skin. There's a long list for you to remember later on. So now, if you want to tell the story, this is a whole story lah. I already prepared all the script for you. But once you understand that, it's perfect, no problem, yeah? So then you can read this. Relation, no need, yeah? Okay, now, this is what happened if anterior neural pole tatapan tutup, it will cause anencephaly. Kalau posterior pole cannot close, we call it spinal bifida. Spinal bifida either is, this is your spinal cord, yeah? And this is the vertebral column. If there's no vertebral column is growing, then the person will have spinal bifida occulta. It is represented by a tuft of hair. Okay? And this is the spinal bifida called meningocele. That means there is a cyst, but inside the cyst is only the meninges is protruding. No tissue is involved. No brain, no spinal cord involved. If myelomeningocele, this is a more serious one. Myelomeningocele means this protrusion has both meninges and the spinal cord. So there are three levels. Either is spinal bifida occulta, represented by a tuft of hair, or a cyst, just meninges, or a cyst with meninges and the spinal cord. The rachis is the most serious. Why? Because it's open. Yeah. This is where the case. So this is a cross section where, you know, this is a vertebra called, this is a vertebrae, yeah, the tulang belakang. When there's no arch to the spine to protect it, then this is called spinal bifida occulta. The meninges is still here. The spinal cord is still inside. In this spinal bifida meningocele is, the cyst is growing with the meninges outside. Meningomyelocele is both outside. If rachis, that means the entire spinal cord is not forming. This is the most serious here. Alright? So now, test yourself. This is where the posterior pole fail to close. Ini lah anterior, posterior fail to close. What is this type of spinal bifida? Occulta, very good, yeah? Spinal bifida occulta. How about this one? Can be two of possibilities. Meningocele or myelomeningocele. This one? Totally open, yeah? No groove of the spinal cord. This is called the rachis. And you can see that it always affects the lower limb. Why? Because the lower part of the spinal cord is to control pelvis, perineum, and lower limb. Because they cannot grow, that is why you will always see that the lower limb is undergrown. Yeah, it's not developed well. Very good. Now, how do you detect it? Sometimes we ask in the clinic, can you detect when a pregnant mom is having a baby with spinal bifida? Yes. You can actually take some amniotic fluid and to do the test. You test what? You test the AFP, alpha fetal protein, AFP. This is a normal AFP level. When the sample is showing higher AFP, that means this is an open spinal bifida or anencephaly. Why? Because some tissue of this fetus is releasing into the amniotic fluid. Yeah? And if someone is having lower than usual, this is most of the time is seen in when the mom is having a Down syndrome baby in development. That is very low. This is very high, yeah, in this way. So AFP. Now this is the fate. Very important slide for today. How do you remember all? I actually arranged for you lah. Space go. Neural crest cells is very powerful. Neural crest cells goes everywhere in your body. It will first go to become the Schwann cell. Do you remember Schwann cells this morning? It becomes the Schwann cells. It produces the myelin sheath for all your peripheral nervous system. It produces the myelin sheath for your median nerve, ulnar nerve, sciatic nerve. And it becomes your pia matter, melanocyte of your skin. And this is the one endocrine, you already learned that. Parafollicular cell, C cell is from neural crest cells. And neural crest cells also give you arachnoid matter, not just pia matter, arachnoid matter. It gives you the skeleton of your face as well. And it gives you the endocardial cushion. Your heart, endocardial cushion, still remember that? If you do not have an endocardial cushion, you cannot develop the septum, the valve of the heart. Also from neural crest cells. Neural crest cells also become the ganglia of sympathetic and parasympathetic nerve, also become the dorsal root ganglia, sensory ganglia, and odontoblast for your teeth. So please remember, how favorite this question for me, and other anatomies. We love to ask, list some example of the derivatives of neural crest cells that can become part of the nervous system. So you don't give me this. If I say it's nervous system, what's your answer? Should be this, right? Anything about this is related to the nervous system. If I say give me some example related to, maybe I say that related to the skeleton. Right? Skeleton. Or related to the meninges, pia matter and aromatic matter. So that's all for this one. Okay, now. What I admire, how do you actually can keep on having all these lectures? Doctor, because we are forced to sit. By all means, because this is a very this is already in the university. So sometimes teacher here is just to talk. Okay, you can by all means you can actually study with these notes, and you can use complete anatomy to study. So if you need to go, you can go anytime. No, yeah. And this power supply is not functioning. Is there any more power supply there? It might be running out.
Panjang sangat. Jauh sangat, panjang sangat. Hah? Kenapa? Cepat tolong. Tolong. Sini quiet. Bukan. No. Acah. It's very sketchy. Okay. It works.
Can I tahan another half an hour, yeah?
Oh.
Yeah, I tell you, tomorrow even worse, no? Tomorrow the brainstem, your brain will explode. So please make sure, you really eat well before you come.
Cannot eat. Ramadan.
Yeah, that's why you have to make sure before you start your puasa, have to eat really well, double the dose, yeah?
Whoa.
Double the dose. Hey, speaking of that, we are actually going to have one talk, no? Actually by a few scientists and also collaborate with Pusat Islam UPM. It's about Ramadan and pembaziran makanan, no? You know, recently there has been news talking about at the buffet, at the buffet of Pasar of the Ramadan buffet. So actually, sometimes I find that not just because of it's just about the habit. Yeah, even when I was in the United States, at the buffet area, you always see that people maybe taken more than they can eat, right? Yeah, sometimes we have to really think twice. Food nowadays really, really precious. Yeah, every preparation we try to save. We have 3 speakers actually, including our Prof. Didi. Prof. Liza Barakatu is one of the speakers to talk about the mentality, pembaziran makanan semasa buffet, and also Ramadan. So I think that it's good that all of us also make use of this holy month and to reflect. We have to really sayang makanan. Yeah, please make sure that you eat moderately. Yeah, eat moderately, don't waste food. Yeah, the culture. We are civilized.
see what kind of
You
eating.
see, I only cover this part, no? Now I'm coming to spinal cord here. Yeah, spinal cord, I already cover all the areas, the functioning area of the brain, yeah, here. And then the spinal cord. But spinal cord, we are talking about cervical, thoracic, lumbar, and sacral. I give you a very good foundation here now is, spinal cord has 31 segments. That means it has 31 pairs of nerve roots. Right side, left side, 31 pairs. The knowledge of why you need to study spinal cord is because all the sensory will come back from the toes, come back to the brain and integrate by your primary somatosensory area, betul tak? Then your motor will all come down from the primary motor area. It will pass through the spinal cord to reach your upper limb, to reach your trunk, to reach your lower limb. Everything must go through your spinal cord. If the spinal cord is injured, this will, so when you talk about patient, you have to ask not just about sensory, because this will affect motor as well. Yeah? So you actually have to detect too. Then we are going to look into the spinal cord has gray matter and white matter. Whenever I'm talking about gray matter, it is because it's the neuron body is there, the cell body, where the synapse happen. Okay? When the synapse happen, that means, yeah, from here, let's say I want to move this finger. The instruction is coming from here, from where primary motor cortex, you have the pyramidal thread coming down. This is upper motor neuron coming down, until the C5. So remember your brachial plexus? Your brachial plexus, what are the nerve root? You don't give it back to the lecturer.
C5, T1.
C5, C6, C7, C, and T1. So when you reach to C5, then together with all the plexus, yeah, then it will supply to your nerve that is going to contract the thumb. But when it reach from upper motor neuron, it reach to the spinal cord. From the gray matter, it will synapse. From there, it will pass over from upper motor neuron, it will pass over to lower motor neuron. Lower motor neuron will then reach to the muscle. So if there is injury at the nerve here, it's called lower motor neuron lesion. If injury before the synapse is called upper motor neuron lesion. So if injury in the brain is called upper motor neuron lesion. Just remember that, yeah? So you have two types of neuron, upper motor neuron, lower motor neuron, yeah? And you always have to know which type of neuron injury is that. So now, so he is a Superman, you know him, but yeah, and during one incident, yeah, when he fell from a horse riding, he actually suffered quadriplegic, 4 limbs, neck down. You know why? Because he snapped the spinal cord right at the upper cervical segment, almost the first segment. The first segment is where all your motor neurons start to go down, no? And all the sensory that comes back truncated. So he actually suffered neck down. Then you start to ask me, then how about his face? Why he actually still can? He lately just delivered. No, he actually, I think he's passed away. He passed away now. Yes, passed away. So he actually in his late life, after he suffered quadriplegic, he actually still makes some public appearance, and he still can talk. Then you start to wondering, what happened? Let me tell you later on, Dr. Chiknoma, Dr. Huda, Dr. Rasif, that will come in to tell you different, because you have different set of motor to control the head and neck. Another set of motor to control neck down all the limbs. To control the spinal cord, to control all the limbs is from spinal cord. But to control the head, the neck, head and neck is because by the special cranial nerves, and they are not through the spinal cord. That is why he is still spared for his head and neck function. Yeah? So now we are going to have a look at this. So now the spinal cord has, this is a blue cervical, orange thoracic, green is lumbar, then you have sacral, then you have coccyx. Now, they are following the contour. What I want to tell you is, you see, from the cervical, you have the first nerve root, C1 spinal nerve root, C2 spinal nerve root, C3, C4. They are very short. Betul tak? This is first above the C1. This is in between C1, C2. Then the C3 is between C2 and C3. Lumbar, this is a lumbar vertebra. This is a spinal cord. Do you see that the orange line, the spinal nerve root, is getting longer and longer? Look at the one from the lower lumbar. So long. What happened here? When you're still a baby, yeah, the length of the spinal cord and the length of the bone almost equal. But when you're growing taller and taller, your bone's growing faster and faster. So your spinal cord cannot catch up. So what happened? But since when they are in the development, they already trapped, they already choose this is the exit. They have to follow the same door. But these bones are growing so fast, they cannot catch up. So what happened here is, the only way is the nerve roots are being dragged down, becoming longer and longer. After that, this whole bunch of nerve roots, we call them cauda equina. What do you mean by cauda equina? Cauda means at the end. This is the cranium, this is a cauda. Why equina is like the horsetail, a bunch of horsetail. This is actually all the nerve roots. And now, this is where the knowledge comes. Still remember, your spinal cord is actually also swimming in CSF. But CSF is very good. Any body fluid is very important. Urine, blood is body fluid. CSF is very important. If you can extract some CSF, sometimes it will help you to determine, you can tell is there any infection in the central nervous system. That's why you have to take some spinal fluid. But if you take the spinal fluid, you have to look for the area that's with a pool of spinal fluid. Where is it? Lumbar system. That's why you look for the lumbar system, where there is a larger area for you to take the CSF. But if you take CSF, you must be careful. If you insert the needle, if you insert at the L1, this is you, an adult, your spinal cord ends at L1 vertebra. Your spinal cord to stop here. If you insert needle at L1, you may hit the spinal cord. Hit the spinal cord, you can cause paraplegia. If so, you cannot go above, you must go down. Most likely, I will recommend you should extract, you should take the lumbar puncture at lumbar vertebra 3 and 4 is very safe. In adult, if in children, young children, the lumbar will, the spinal cord will stop at L3. If in children, the spinal cord stop at L3, you should take at L5 and S1. Remember this, very important one, I'm just telling you. Where is the safe site for lumbar puncture? You have to write, if it is in adult, the safe site is between L3, L4, lumbar vertebrae level. If in children, young kids, it should be between L5, S1. The reason is because your spinal cord ends at different level. In adult ends at L1, in children ends at L3. Then you ask, what's the big deal? It's a big deal. Yeah? If you do not know this, you will hurt the central nervous system. Central nervous system have very limited regenerative power. Yeah? You cannot afford to hit the spinal cord. Yeah? So this is the major. Then you ask me, doctor, if I insert the needle, it still will hit our cauda equina. Isn't it also central nervous system? Betul tak? Can you avoid not hitting the nerve root? You will hit the cauda equina. But the cauda equina, just like when you are combing your hair. When you comb your hair, what happens? The hair will split away, right? When you insert the needle in between the nerve roots, worry, that will split away. It will not hurt them. Okay, so this is how, what is the science behind it, yeah? Cauda equina. The split away, don't worry. And now, today, the bring home message is, if you cut the cervical, this is where the OSPI we love, yeah? Sometimes we give you a cross section and ask you, predict, is this a spinal cord from cervical, from thoracic, from lumbar, or from sacral? So we will quickly look at that. Do you see the changes here? What you can see is white matter on the outside. In the center is butterfly-shaped gray matter. Look at the cervical. All the cervical, C1 to C8. This is the anterior horn, posterior horn. Anterior horn is for motor, posterior horn is for sensory. You'll find that the anterior horn of the cervical is larger than usual, larger than thoracic. Why? Because this has more motor neuron for your upper limb, right? Because you have upper limb. So that's why you have more cell body for the motor neuron to supply your upper limb. That's why the anterior horn is larger. Now, coming back to thoracic is smaller. Why? Because it's only trunk muscle, not much. So you don't have the brachioplexus. Brachioplexus only here. Now, coming to lumbar is another one. Coming to lumbar, you can see that the anterior is larger. Why? Almost similar explanation. What is your answer? Because it houses more motor neuron for the lower limb. Yeah, that is lumbosacral plexus. So you have learned two plexus, brachia, lumbosacral plexus. Because of more motor neuron to supply lower limb. And then, when you see this, at the thoracic, you will see one lateral horn. Lateral horn only here. Why? Because lateral horn is for sympathetic, betul tak? Parasympathetic. Is that true? Thoracolumbar, what is that for? What is that for? Sympathetic, yeah, for sympathetic, yeah, lateral horn. So you see lateral horn only here. Now, coming to sacral. Oh, no need to say that. Sacral is the lowest. And with the least number of sensory fibers, with the least number of motor neuron, of course, the white fibers is the less, the gray fibers also the less. But coming up to the cervical, everything is the most. Because the most of sensory, the most of the motor. Right? Everything sensory must come back. Must melalui cervical. Yeah? So this is where it is. So now, ini you can read. Here. This is our spinal cord, yeah? Spinal cord is protected by 3 layers. The red is pia mater. This dotted line is arachnoid matter. And the green is dura mater, DAP, yeah? And in between, this is the CSF. Now, I want to say that your pia mater has 2 things. This pia mater, the red, why is it red? Do you know why is it color red? Because it's beautiful.
That's good.
You know why it's color red? Pia mater is full with blood vessels. That is why it's always color red in standard textbook. And the pia mater also form at the side ligamentum denticulatum. That means it's form a ligament like a dentate, yeah, bergerigi. Why? Because your spinal cord could move left and right side. But luckily you have this pia mater that become the denticulum, the ligamentum denticulum. So it will actually give a lateral stabilization. So that when you are moving left and right side very fast, it will hold it in place. First, remember this, lateral stabilization is done by pia mater to become the ligamentum denticulum. So your spinal cord is very much stabilized because it attached to here. Now, we go to this part here. This is our favorite diagram. Favorite diagram of when I say that means labeling cups. Now, do you see the spinal cord here? It is not, dia tak seragam ketebalan dia. You can see that cervical is enlarged. Lumbar is enlarged. Can you give me a reason?
Motor.
thicker? Why lumbar is thicker? Why cervical is thicker? Because of more
Water.
motor neuron to supply the upper limb and lower limb. If you cannot remember, don't worry. Dr. Miss is always very good, right? I give you the reason here. Okay? Here. See that? Because you have the lumbar enlargement, especially because you have the sacral-lumbar plexus for musculature of lower limb, musculature for upper limb. This is your explanation. Don't just read it, learn to write it because it's important. It is important to know why spinal cord is tak seragam ketebalan dia. Kenapa cervical lebih tebal? Then it becomes slim again. Then kenapa tebal again at lumbar? Very important. So when you draw, this is a good drawing. Thicken, slim, 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 thicken, slim again. Now I come back to here. This is where, here, this is where you have a lot of the cauda equina. Although you have a lot of cauda equina, one of these, the Pia method, the Pia method, the red color, will pierce through the dura method, and then it attached to coccyx. This is actually we call phylum terminale. Phylum terminale. You must name this, phylum terminale. Look at what is T doing. He's suspending him upside down. You know what? If you be suspended upside down, your spinal cord can actually just come down and bang onto the cervical region. Luckily, it doesn't happen this way because you have something to hold it. What is that? Phylum terminale. Good thing is your Pia method very important. Your Pia method, besides protecting the spinal cord, laterally it forms ligamentum denticulum to stabilize it laterally, but caudally it also forms a phylum terminale to attach to the coccyx bone, so that when you are going to do all your roller coaster, all these dangerous acts, your spinal cord stay in place. Yeah? Okay, so this is how it stabilizes the spinal cord, phylum terminale. But your phylum terminale has two parts. One part is within the dura sheath, it's called phylum terminale internal. One part is after it pierces through the dura sheath, it's called external. But usually very important is this one here, the phylum terminale. This is cauda equina. And cauda equina here is formed by all the nerve roots, the lower nerve roots. So now, the tail of the spinal cord is not hanging loose. It is actually anchored something to connect to coccyx bone. What is your answer? B, right? But what forms the phylum terminale? Very good. Dura method, Aronoff method, Pia method is Pia method. This is how we will ask you one question after another. First, I ask you, identify what is this. You name it. Then I ask you, name the connective tissue. Name the tissue that contribute, or name the membrane that contributes to the Pia method. The membrane. So now, this is something you already know. You have spinal nerve root, you have anterior is motor, posterior is sensory, so easy. So now I go to this part. This is what I explained to you. Why you have cauda equina? Because when you are growing from 3rd month until adult, you see your spinal nerve, your spinal cord initially stop at S1, then slowly stop at L3, then slowly stop at L1. This is the reason why, Okay. So now test yourself. The corners, this I haven't told you. This is also important, The end of the spinal cord is called cornus medullaris. That means it's a cone shape of your medulla oblongata. So that's why it's cornus medullaris. Cornus medullaris. So now let's try this question here. The cornus medullaris is tapering end of the spinal cord. It is located at which vertebral level in an adult? Very good. L1, L2, remember, is between lumbar vertebra L1 and L2. In children, L3 and L4, or you can say L3, yeah? Very good. This is for children, yeah? This is for even earlier. This is for the above, yeah, above. So now I'm going here. This is something we already learned, BAP. No worries, yeah. This is when you perform, yeah, when you perform lumbar puncture, you ask the patient to lie down, and he will have to bend. You have to actually ask him to have a lateral recumbent, and then even better if you arch, because the more you open up the intervertebral space, so that it's easier for you to advance the needle. Yeah, and then the safe side, yeah, this is something that you must remember between L3 and L4 in the adult, yeah. Okay. So now, name the structure that anchor the spinal cord to the dura mater. You say, betul, doktor. Tadi saya tak kata lah, ni here. Ni. This is a tentacular ligament yang bergerigi, is made by pia mater. These are pia mater. On Wednesday, in the museum, you will see this. We harvested the brain and the whole spinal cord, and we open up the meninges. You can see that how the pia mater here attached to the dura mater. Pia mater attached to the dura mater. This is a bergerigi. This is a tentacular. This is the tentaculate ligaments. 1, 2, 3, like this. They are bergerigi. You will see this in the specimen that we harvested. So the answer is tentaculate ligament. Yeah? All right. So almost coming to the last part. I will talk about this later. Yeah. Don't worry. Okay. Before you go, take a good rest lah. Pity you. Spinal cord blood supply is very important because it is very long compared to the brain. This is very long, yeah, 45 centimeter from cervical C1 until L1 here, 45 centimeter. So it is supplied by, because it's so long, it is supplied by anterior spinal artery. You have one anterior spinal artery. And this anterior spinal artery, a spinal cord is supplied by anterior spinal artery. Anterior spinal artery is formed by vertebral artery, left and right side. This is your vertebral artery, right and left. These two will combine to become anterior spinal artery. This anterior spinal artery will run down, almost coming to the cornus medullaris, then it split to two. When it split into two, it will turn backward. This is anterior, this is posterior, and then it will start to anastomose. Anastomose dengan siapa? Dengan two posterior spinal artery. So again, spinal cord has supply of three. One is single anterior spinal artery going down until it comes to the end. It will split into two and go to the back and wait for anastomosis. Then from posterior, it is supplied by two posterior spinal artery. Tak cukup, not enough, because your spinal cord is too long. The blood supply from above to down, always your sacral segment always losing, sentiasa rugi, because your sacral have to wait so long before the cervical ambil darah, kemudian thoracic ambil darah, kemudian lumbar baru sampai sacral. So sacral kata tak adil. So what happened? Then you have the third supply. It's called segmental. Yeah. So you have anterior spinal artery from left-right vertebral artery. Then you have the posterior spinal artery. Then you have segmental. Segmental is this way. You see, this is segmental 1, 2, 3, 4. You have segmental coming in and cervical, segmental coming in and thoracic. That means these are the ones that give you the side way of supply to help to reinforce. If not, then your spinal cord can easily lack of blood supply. It will hemiplegia as well. So that's why you have the third set, anterior, posterior, and segmental. And this segmental, one of these is very big, so big that we call this the dominant arterial feeder, always on the left side. We call this is called arteria reticularis magna of Adam-Kivich. Magna, so big. This Adam-Kivich is the artery at T1 and T11, larger than the rest. Then you ask, why T1? Yeah? You know why it starts from T1? Because when the blood starts from C1, C2, C3 until C8, so remember just now you have a larger enlargement for the lumbar because you have upper limb. Sudah tak banyak the artery. Not much of blood left for the thoracic. So it has to reinforce at T1. Then at T11, why it has to reinforce? Because that's the beginning of your lower limb that you have lumbosacral. If you do not reinforce at T11, later on you'll start the lumbosacral, mana dapat darah. So that's why you have the Adam-Kivich magna of artery. Yeah? And this artery is so important, always on the left side. This is my whole explanation here. Why you have one of these is larger than usual, called Adam-Kivich. Yeah? So now, class, today you must learn, if you in the exam, we give you a cross section of the spinal cord, and this is the gray matter, white matter. You must be able to draw this line. Yeah? This is the central canal. Anterior spinal artery supply anterior 2/3. Posterior spinal artery supply posterior 1/3. That's it. You must remember this line. Draw this into anterior 2 vertical and the posterior 1 vertical. What does it supply? The anterior spinal artery. It supplies the anterior horn. It supplies the lateral horn. It supplies the base of the posterior horn. Then, this is all answer here. Yeah? It supplies the anterior horn, lateral horn, and the base of the posterior horn. It also supplies the anterior white column. This is anterior white column, lateral white column. Okay? Please remember this, yeah? Anterior 2/3 of the white column. Ini akan ditanya, ya. This is another important slide. Please put 2 stars, yeah? So anterior spinal artery will supply anterior horn, lateral horn, and the base of the posterior horn. It supplies anterior white column, anterior 2/3 of the lateral white column. Then the rest is supplied by the posterior spinal artery. So this is what I want to say about the Adam-Kivich. Now, if there is atherosclerosis, that's why you have to mind your diet. If high-fat diet, this can cause atherosclerosis of the vertebral artery. You may have an emboli from the heart, and this can cause an acute flaccid paraplegia when there is an injury to the area of the anterior spinal artery. We'll talk about this later. Yeah? Before you go, let's try this. What is the true statement about the spinal cord blood supply? True, no? A betul atau salah? Salah, because it's single anterior spinal artery. B, anterior spinal artery, is it from vertebral artery? It is from vertebral artery, from left and right vertebral artery. C,
Salah.
kenapa salah? Yes, because the posterior spinal artery ada 2. D, where is actually the posterior spinal artery from? Yeah. This is the last one. The posterior spinal artery are actually from PICA, P-I-C-A. It is from posterior remember it for now. Yeah? Okay, take a good rest. I see you then in the afternoon. Thank you. Bye-bye.
Thank you, Dokter.